Starting off at tip number 1. Breathe deeply and try meditating. Deep breathing and meditation are two exercises that will help calm your body and relieve pain. This is because they relax your muscles. When your muscles receive a quiet massage to relax, then tension and tightness seep out of them, which is crucial if you want to get rid of your chronic pain. Let's start with meditation. Although there are several different types of meditation, but the main principle is to relax yourself. While you can learn to meditate on your own, but we recommend that you take a meditation class to get a full, guided relaxing experience. Likewise, deep breathing is also a method of relaxation. Deep breathing is something you can do anywhere and by yourself. But if you're looking for a guided breathing session, then we will link to a free breathing routine by Wim Hof in the description below, which we highly recommend you check out at least once. If you want to start deep breathing by yourself, then here's what we recommend. Firstly, block out distracting thoughts by finding a peaceful place and sit in a relaxed body position. Now visualize a point just below your navel. As you breathe into that place, fill your belly with air as if you were deflating a balloon. Let yourself fill up with air from your abdomen up and slowly let it out. You can try deep breathing in a convenient, quiet place or whilst lying down or whilst reclining in a chair. The choice is all yours. As a rule of thumbs, in order to get the most out of your deep breathing session, allow yourself at least 5 to 10 minutes of distraction-free time, where all you are doing is deep breathing. During this time, you want to deliberately relax your muscles. Is there a spot on your body where you're tense, or area where your chronic pain occurs the most? If this is the case, then be aware of it and focus on relaxing that area whilst you continue deep breathing. Inhale for 4 to 5 seconds, and each exhale should also last from 4 to 5 seconds. By counting down your breathing, inhale and exhale, you will make your heart rate slower and fully clear your lungs, which will help clean out any built-up toxins in your body. Note, when breathing, inhale through your nose and exhale through your mouth or nose. And concentrate on belly breathing. Imagine your stomach inflating and deflating as you breathe. To get a good feel for this, place one hand on your chest and the other on your belly to see if you are deep breathing properly. On to tip number 2. Reduce the amount of tension in your life. Patients of chronic pain, understandably, tend to concentrate on pain reduction. This emphasis is beneficial to some degree. There are a lot of lifestyle changes that can help relieve pain over time, such as aerobic activity and daily calming exercises. Some drugs, such as tricyclic antidepressants and anti-epileptics, have also been shown to help with pain relief. But science still has a long way to go, because we don't have any medications for chronic pain that are extremely successful. Depression, anxiety, tension, and frustration are all negative emotions that can make your body more sensitive to pain. But by managing these emotions and stress, you will find great relief from your chronic pain. Several methods can help you reduce stress and to relax. These include listening to relaxing, calming music, which will improve your mood and make chronic pain easier to bear. There are also relaxation tapes that are specifically made for this purpose. Another technique is driven imagery, which is a form of mental escape that can help you relax. Driven imagery means gathering up thoughts in your mind that make you calm. For example, you might think of a childhood experience that you loved, or listen to a song that brings back good memories. Another method for relaxation is progressive muscle relaxation, which is a big topic. If you want us to create a special video on how to do progressive muscle relaxation correctly, then be sure to let us know in comments. Tip number 3. Natural endorphins will help you a ton with chronic pain relief. Endorphins are brain chemicals that improve your mood while also reducing pain signals. Endorphins are natural pain relievers produced by your body. They block the perception of pain by hugging special receptors in your brain. So, by increasing these natural hormones, you can significantly reduce pain while still producing intense feelings of pleasure and satisfaction. Exercise is a big one. By exercising, you release a lot of endorphins in your body. Exercise also helps to relieve discomfort by strengthening your muscles, which reduces the likelihood of you getting injured again or feeling pain. And on an obvious note, exercise will also help you lose weight, reduce the risk of heart disease, and keep your blood sugar levels in check, which is especially important if you have diabetes. As always, consult your doctor to determine the best workout regimen for you. Tip number 4. Limit alcohol consumption because it can worsen sleep issues. Alcohol is commonly misunderstood to be an important painkiller. The truth is that drinking alcohol will worsen a painful condition. Even though alcohol does not specifically relieve pain symptoms, it does, however, cause your central nervous system to become confused, causing pain signals to be misinterpreted. When chronic pain and alcohol are combined, there are many dangers. These involve alcohol addiction, pain medication interactions, and a worsening of pain symptoms. If you have a chronic pain disorder, it's critical that you talk to your doctor about your drinking habits. It's also worth mentioning that adding alcohol to any pain medication is extremely harmful, because mixing alcohol with medicines like acetaminophen or Tylenol can cause liver failure. And mixing alcohol with aspirin can cause gastric bleeding. Not only that, but drinking while you are on opioid pain reliever medicine can be fatal, because this combination can block your breathing, especially in the elderly. As we said, when you're in pain, sleeping is difficult, and drinking alcohol can make it worse. So, if you have chronic pain, then start to drink less, and eventually cut out alcohol for good. Tip number 5. Do exercise. This is a simple one that we briefly talked about already. Moving your body is beneficial to your health and can do wonders in reducing your pain. We can't stress this enough. Consult your doctor first, and they will help you develop a healthy workout routine that is custom-tailored, especially to your needs. Note, your workout routine should be tailored to your current fitness level and take into account all of your diagnoses. And remember, when we talk about exercise, you don't have to limit yourself to the gym. You can start to exercise at home, either on your own or with online videos or DVD, or you can enroll in a local rehabilitative exercise class. See, there are a lot of options to get you moving. You just have to pick the right fit for you. Exercising will help you maintain your mobility if you have chronic pain. It also keeps your muscles active and your joints flexible, which can help with chronic pain symptoms. Do you know what's disuse syndrome? Well, it's a disorder in which your muscles weaken because of inactivity. The only way to avoid this is by regular exercise. Even if 3 or 4 of your muscles are weak, then they are more prone to discomfort and can also result in further injuries. So simply start to move that body for heaps of benefits that science is still yet to discover. Tip number 6. Quit smoking because it will make your chronic pain worse. Tobacco use is linked to worsening pain severity, physical function, and psychological effects in patients with chronic pain. Lower back pain is almost 3 times more common in smokers. Smoking can also aggravate abdominal and joint pain. The truth is that smoking can make people more sensitive to pain in general. This is because tobacco use oftentimes leads to diseases that cause chronic pain in the first place. For example, smoking contributes to osteoporosis and weakened spinal discs, resulting in chronic back and neck pain. Studies show that smokers are up to 2.7 times more likely than non-smokers to suffer from lower back pain. Smoking also leads to joint pain, which is associated with diseases such as arthritis. Likewise, if you're a heavy smoker, you will take longer to recover from pain compared to non-smokers. Tip number 7. Track your pain levels every day. In order to effectively manage your discomfort, the doctor wants to know how you've been doing in between appointments. You can keep track of your pain by keeping a log or journal of your regular pain score. For example, you can make a note of your pain level on a scale of 1 to 10 at the end of each day. Try your best to make a list of what you did that day that caused you more or less pain. Now take this logbook to your doctor's appointment to help your doctor understand how you're dealing with chronic pain and your level of physical functioning. Many apps today can help you keep track of your daily activities for chronic pain patients. We recommend Pain Scale, which is a free software that provides a ton of pain control resources to help chronic pain patients keep track of their pain. Or on the other hand, you can buy a pain tracker journal. The Pain Diary, which was developed by physicians and chronic pain patients, serves as a pain tracker and allows you to put together all of the details a patient needs in one place. Tip number 8, learn how to use biofeedback to help relieve the discomfort of migraines and stress headaches. Biofeedback is a type of therapy in which sensitive electronic instruments are used to monitor a person's physiological functions, such as heart rate. This information is then fed back to the patient. Through this, a person can learn how to regulate their own physiology, and in many cases, learn how to minimize symptoms and improve their body function using this biofeedback knowledge. There are two main types of biofeedback. These are peripheral biofeedback and neurofeedback. Both have been shown to be effective in the treatment of a lot of chronic pain conditions. It may sound like science fiction, but biofeedback has been shown to be effective. Plus, it's not difficult to learn. This is how it works. Firstly, you will be wearing sensors that allow you to hear or see your own bodily functions, such as heartbeat, digestion, body temperature, and muscle tension. There will be attached monitors on which you can see squiggly lines and beeps, which represent what's going on inside your body. Using these lines and beeps, you have to figure out how to handle this information. This is a big topic, so we will cut to the chase. By using biofeedback, your mind will become conditioned to your biological system. And after a few sessions, you would have mastered how to read your body for signs of pain and what to do about it. Tip number 9, eat a balanced diet. A well-balanced diet is beneficial in a lot of ways, including assisting digestion, lowering the risk of heart disease, maintaining weight control, and raising blood sugar levels. The basic idea of a diet is that patients with chronic pain need a high-protein diet that avoids hypoglycemia and weight gain caused by carbohydrates like sugars and starches. A diet is also meant to help with strength, mobility, energy, and mental function. Doctors also recommend taking dietary supplements to help with tissue regeneration and to avoid pain conditions like osteopenia and osteoporosis. In reality, high-processed food diets are a major source of inflammation. Foods that cause inflammation are called pro-inflammatory. When you eat these pro-inflammatory foods, they can cause more diseases like diabetes and heart-related diseases. On the other hand, we recommend that you eat anti-inflammatory foods and supplements because they bring healing and reduce pain. So, if you want to get rid of chronic pain, then avoid any food that is refined, fatty, or encourages inflammation. This is because they will cause you more pain in the long run. Instead, eat fresh fruits and vegetables, cooked dried beans and peas, whole grain breads and cereals, low-fat cheese, milk and yogurt. Also, eating lean meats are all good choices for a low-fat, low-sodium diet. And finally, last but not least, tip number 10. Save your strength for your family. It is important to keep track of time. When it comes to dinner time, some patients are tired and go to bed early. This means that they frequently miss out on quality bonding time with their families. The pain psychologists recommend that you should save energy throughout the day, so you can be completely present at home both physically and emotionally. Being less generous to other things during the day will help you bond better with your spouse and children throughout the evening. The ability to say no can be a new, yet crucial skill for setting boundaries and allocating minimal good time to the most important things and people. So, even though chronic pain can be very painful as the name suggests, but practicing these simple 10 tips will help you get the most relief as quickly as possible. If you're experiencing chronic pain or have tried other methods that worked. Then we would love to hear about them in comments below. Make sure to subscribe for more videos like this, and we will see you in our next video.